It's a very intelligent way of distributing electrical current around an electrode with only 8 contacts. And these 8 contacts, of course, cannot, in a granular, fine way, address all directions and all dimensions in 3D space. But in combination with the technology that is called multiple independent current control, you can virtually program any direction and any orientation around the electrode. It is a new technology. It requires new electrodes that are segmented. Before we used ring electrodes, where the electrical current was distributed like a sphere around each contact. And with segmented electrodes, you can steer the current in different directions. But the electrode and the pulse generator, the IPG, have to be seen as one unit because particular technologies inside the pulse generator allow a much more fine-scale distribution of the electrical current. The advantages of directional DBS is that you can focus the electrical current in the brain. You can steer electrical current towards areas where you can improve symptoms and away from areas that potentially cause side effects. So it's a much more precise way of stimulating the brain than omnidirectional stimulation. It looks complex at first, but you can make it very easy. If you leave the traditional way of using a so-called monopolar review. We had to learn about the capabilities of the system. And of course, a physician is eager to test all possibilities. And so we experienced that we could much better address individual problems of individual patients by using this directional stimulation, reduce adverse effects such as speech or other adverse effects, but also improve efficacy. So that we see a larger proportion of patients with very good outcomes from deep brain stimulation than we would experience before. And many of our patients now have directional settings.